These are busy times. Every day, faster and faster. In healthcare, change is happening just as fast. We have more patients than ever before, and less time to see them. Keeping up is tough enough. But when new challenges arise in our midst, it gets downright taxing. Challenges like the growing epidemic of prescription drug abuse. You've seen the numbers. You know which way they're headed. And legislators are noticing. And that means a whole host of new laws and liabilities, proposals and bills, regulations and reporting. How can physicians and other prescribers keep up? The Ohio State Medical Association has got it covered. The SmartRx online training program gets busy physicians exactly the up-to-date information they need when they need it. And you've never seen training quite like this. 15-minute modules available 24/7 on whatever device you'd like. Smartphone, tablet, laptop, or PC. Each course is quick-paced, highly visual, and interactive. And best of all, physicians and prescribers can take the training when it suits their schedule. They can pick up any time, right where they left off. SmartRx pairs the latest expertise and analysis of prescription drug abuse with the cutting-edge online training techniques designed for today's busy professional. OSMA gets providers the information they need to stay safe while providing great care to their patients. So, what's the training look like? Let's take a quick look.
Prescription drug use and misuse is on the rise. How fast? 6 to 7 million Americans abuse prescription medications each month.
Among teens, prescription drug abuse is second, just behind marijuana. And unintentional drug poisoning is one of the leading causes of accidental death in the U.S.
Legislators have taken notice, with many states rolling out new laws aimed at addressing the issue. In Ohio alone, no fewer than a dozen bills are currently making their way through the legislature, with more still under consideration.
Painkillers are among the most abused, and this puts physicians and prescribers in a tough spot. How do we treat our patients' pain while staying safe and in compliance in a quickly changing regulatory environment?
What role can opioids safely play in pain management, and how can we reduce the risk of abuse by our patients?
The 4 15-minute courses in SmartRx cover the strategies and practices you need to stay safe.
We'll start by looking at the current regulatory environment, understanding the extent of the problem, and detailing exactly what a provider needs to know before writing a prescription.
Then we'll look at strategies for staying in compliance. This course unpacks the pending laws and bills related to prescribing, and it explores the most recent prescribing guidelines for opioids.
The third course focuses in on educating our patients, not only on the dangers of misuse and abuse, but also on the ways we can help our patients consume their medication appropriately.
Finally, we'll conclude with a survey of alternatives to prescribing that are being explored and implemented by colleagues and peers.
In each course, you'll hear directly from fellow prescribers from across the state who are wrestling with the same issues facing you in your practice.
By the end of the program, you'll not only have an up-to-date understanding of the problem and the regulatory environment addressing it, but you'll be armed with new strategies, tools, and ideas to help you stay safe and provide great care to your patients.
Ready to get up to speed?
Let's do this.